Welcome to the Idea Exchange podcast. In today's episode, we'll be talking more about diabetes. I'm your host, OSP, and our guest is.
Dr. Yamikan Queens.
What does diabetes mean?
So diabetes basically is a metabolic disease which is associated with high blood sugar levels in blood.
All right. What are the epidemiology of diabetes?
Okay, so when you talk of epidemiology, we mean how common the disease is, in what groups of people it is common. So when we talk of epidemiology, we mean which groups of people is it more common. Okay, so basically diabetes is a very common, one of the commonest non-communicable disease. It is about 1.6 million people worldwide, and about 5 to 10% of all the patients in hospital which admit in hospital have diabetes. So you can see how severe is it. Around 10 people out of 100. It's one of the common thing. According to the age, it affects mostly either people who are less than 20 or people who are more than around 35 years of age. Yeah. So it depends on what type of diabetes. I think we are going to explain about. I don't know whether it's classification or types of diabetes as we go on. So yeah. So basically that's it.
All right.
But maybe I should just add something. According to gender, it affects mostly women. Yeah, and also according to race, it is more prevalent in African American people. People who are maybe my mother is from Africa and my father is from America. These people, they have combined races. So it's common in this, even in Americans, because it's not a disease of, it's not really common in poor people, but it's more common in well-to-do people who are able to eat properly. Sure.
All right. What are the causes of diabetes?
Maybe when you talk of causes, it depends on what type of diabetes do you have. So basically, we have two types of diabetes. Diabetes, we should call it diabetes mellitus. So we have two types of diabetes mellitus. Because we have another type of diabetes, we call it diabetes insipidus. But today we are talking of diabetes mellitus. So two types of diabetes mellitus. We have type 1 diabetes mellitus. We have type 2 diabetes mellitus. So type 1 diabetes mellitus is common in children under 20 years of age, but it peaks around 4 to 6 years of age, and around 10 to 14 years of age. So that's where you usually see this kind of diabetes. Now you have asked about the cause now. So the cause of this childhood diabetes mellitus or type 1 diabetes mellitus is insulin deficiency. So lack of insulin. In our body, we have pancreas. The function of pancreas, one of the functions of pancreas is to produce insulin. So it's this insulin which is responsible for taking off glucose from blood into cells. So if you don't have this insulin, it means the glucose which is in blood will remain there. It will not be going into cells because insulin is not there. So lack of insulin will lead to high glucose in blood, diabetes. Yeah, so basically in children, it's lack of insulin. But the other type of diabetes mellitus or diabetes mellitus type 2 is common in adults. So basically, people who are more than 40 years are the ones which are more common to develop this kind of diabetes type 2. The specific causes of this diabetes type 2, there are so many. One of them is due to autoimmune diseases. It's either body is not producing enough insulin. You remember type 1 is due to body not producing insulin at all. You remember?
Yeah.
But in type 2, is the body is producing insulin but not in required amounts. Or the body is producing enough insulin, but then the body cells are not responding properly to that insulin which is being produced. So it's either way, not enough or body is not responding. So yeah, basically.
What are the clinical features of diabetes?
Okay, so when you talk of clinical features, we mean signs and symptoms. Okay, we can see in a patient who has diabetes. So sometimes they may have the common symptoms. When we see these symptoms in a patient, we say this patient highly likely has diabetes. They may have, they may be drinking water very frequently. So we call it like thirsty. They have frequent thirst. So they feel very thirsty very frequently. So they take a lot of water. The time which you have come here, maybe you have already taken 3 cups of water. Yeah. The other feature is polyuria. Polyuria is a frequent urination. So just because you're taking water frequently because of thirst, what do? You go to the toilet frequently. The last feature, the common feature, is polyphagia. Polyphagia is eating very frequently. So people who are diabetic, they feel hunger very frequently because the cells are not being fed. So you feel hungry. So you eat a lot. But there are other features which you can easily see, but these are non-specific. They are not really specific for diabetes, but people with diabetes may also present with them. So what are these? They may have unexplained weight loss or weight gain. Okay, so you see someone is just getting weight, or they are just losing weight without any good explanation. They are eating properly, but the weight is still going. And sometimes they may have visual disturbances, like blurry vision. Sometimes they may have fatigue, weakness, because the cells are not being fed. Remember, glucose just in blood is not going to the cells. So it means metabolism is going to be not enough in the cell due to lack of glucose. So they may be fatigued, very tired. Sometimes they may have pruritus. Pruritus is, I think I should be using vernacular languages, but when you say pruritus, is like itching. In simple English, it's itching. Yeah, so they may be feeling itchy. Sometimes they have poor wound healing. People who are diabetic, they have difficulties to heal from even simple wounds. Sometimes they may have susceptibility to infections because diabetes reduces your immune system. So it means even simple infections are going to be affecting you. So basically, Those are some of the. Sometimes they may have tremors. Do you know tremors? So when you talk of tremors, maybe someone is just moving her limbs without controlling them. They are just moving on their own. Yeah, basically.
And how do you investigate diabetes?
Okay, so a person has come to hospital with features we are suspecting that maybe they have diabetes. Maybe they have diabetes. Um, we test their blood sugar. So we call it a random blood sugar. So we can either do random blood sugar or we can do fasting blood sugar. When you say random blood sugar, it's like a patient has just come. Whether they have eaten at home or they haven't, we test their sugar. So we call it random. The other way we test for fasting blood sugar. Fasting blood sugar is like now we tell a person you shouldn't eat anything for maybe 12 hours. We want to check your sugar. That's fasting. The other way is we also test for sugar, how the sugars have been in either 3 months. There is also a specific test for that. I'm not going to mention it because you cannot really understand it. So basically, those are some of the. Sometimes we do oral glucose test, but not really common in our setting because lack of resources. But that's one way, which is also the best one. Yeah.
Alright, how do you manage diabetes?
Okay. So the management of diabetes, basically, we give patients anti-hyperglycemic treatment. Or in other ways, we mean the drugs that reduce levels of glucose in blood. So there are some drugs which are responsible for that. Maybe you have seen some people taking medications, tablets. So there are of different classes, of course. They target different. Remember what I said? I said sometimes what you like is insulin. Sometimes you are producing a little insulin, or you are producing enough insulin, but your body is not responding. So we give medication depending on these pathways. If you are lacking insulin, like type 1 diabetes, which is common in children, what they lack is insulin. Their pancreas is not able to produce insulin at all. So we give them insulin. So we call them insulin dependent diabetes. And sometimes if you are not producing enough insulin, we supplement insulin. Okay? Sometimes if your problem is body is not responding properly to the insulin which is being produced, we give medication to make sure that we increase body's response to the insulin which is being produced. So that's how basically we manage.
What are the complications of diabetes?
Okay, so um, there are so many complications of diabetes, but they are usually grouped into two. Yeah, we have macrovascular, because normally diabetes also affects blood vessels. So we call them macrovascular. It means blood vessels which are being affected are the bigger ones. Then also we have microvascular complications. It means the blood vessels which are being affected are smaller ones, like arterioles or capillaries. So I'll start by explaining the microvascular complications. One of them is difficulties or eye problems, renal problems, and extremity problems. So it affects blood vessels, small blood vessels in these areas. So that's where a person may have blood vision. Sometimes they may have difficulties in walking, or sometimes they develop ulcers, or when they develop a wound, it may not heal properly because small blood vessels which supply the legs, they are damaged. Yeah, sometimes they have kidney failure because blood vessels which supply the kidney are also damaged. And then I'm looking at a macroscopic now. Yeah, macrovascular. It means macro means big, eh?
Yeah.
Yes. Blood vessels which are being affected are the bigger ones. So they may have stroke. People who are diabetic, they are at risk of developing stroke. Sometimes they have heart failure. Blood vessels which supply the heart, they are also damaged. So basically, that's it.
All right. How diabetes impacts quality of life?
Like how does diabetes impact quality of life? Okay, I'll explain this uh, dividing them into three.
Yeah.
How diabetes has negative impact on our day-to-day lives. Firstly, on the patient themselves, they may have complications, which I've said. Complications of the kidneys, whereby they may have kidney failure.
Yeah.
They may have complications in the eyes,
Yeah.
whereby they may have blurry vision, and even sometimes diabetes progress to total blindness.
Yeah.
One of the things which we look for in a patient who has come with sudden blindness or reduced vision, we check them for glucose, if they are diabetic or not. Sometimes it also affects the lower extremities, especially the legs or the foot. Feet are the ones which are also being affected. But sometimes they have ulcers in the legs. So how do these ulcers come? One way is when you have diabetes, sometimes your nerves that supply the lower extremities are also being damaged. Even the blood vessels are also being damaged. So if the nerves which supply your legs are damaged, even if you step on fire, you are not feeling anything. So you never, even if when you step on, I don't know, minga or the like, you are not going to feel anything. Even if you have stepped on something sharp, you're not feeling anything. So you cannot run away from that. So you develop wounds easily. And because the blood vessels which supply blood to that area, they are also damaged or they have been blocked, what will happen? It means blood is not reaching that area. Even the wound healing molecules are not reaching the area. So a person may have difficulties in wound healing. Okay, so that's whereby a person can have a wound which is not healing at all. And what would that? People lose their limbs. So you hear some people happens and sugar komano ati afuna kadule jani mwendo. Yes. So sometimes they have a chronic wound which is not healing. And sometimes the wound is infected. So there are microorganisms which have entered the wound, and then the person, the wound is not healing at all. Okay. The other way, a person, maybe let's say you are a footballer, you have been found to be diabetic and they have cut your leg, it means your career has been affected. So even your day-to-day functionality, economically, you have been affected. So that's basically, and the other way is financial constraints. I hope you have seen how our musicians, like we lost one of our famous musicians recently, Lucius. Okay, that guy had diabetes, complicated to renal failure. Okay, so he spent almost all of his money on medical bills. So renal failure, I said diabetes affect kidneys, right? Yes. So he had chronic renal failure, which led to him being dependent on dialysis. So dialysis is very expensive. At your single visit, you pay almost close to 200,000. But you need to go to hospital once 3 times a week. So it means in a week you are spending 600,000. So if you don't have enough source of finance, it means you are dead. You are doomed. So it affects financially. And the other way, it affects the family. I started with the patient, then I've gone to the family. Families are also being affected because they need to look after you. If you are in the hospital, you cannot be in the hospital alone. You need people to look at you. Some people even contribute towards your medical bills. Let's say you are poor and you are diabetic. People need to sonker for you. That's why you could hear Lucius Banda was announcing everywhere, people help me. I need money to go to South Africa. Diabetes and renal failure, they are very debilitating problems. They need a lot of money. So the family is also affected. And then lastly, the country as a nation is also affected because they need to buy a lot of medications to support the patients. Like I said, it's a common disease. Almost 10 people, 10 per 100 people, which are admitted in the hospital, they are diabetic. It means we need a lot of medications to help these people. So as a country, we are also affected. So that's how basically diabetes affects our day-to-day lives.
All right. What are the advice would you like to tell those who have diabetes?
Okay, so basically, I should say this: diabetes. Once you are found to be diabetic, you should know that it's a disease for life. Okay? Yeah, it's not really curable. You cannot say now I'm diabetic free. No, but there are medications which are designed for that. Okay?
Yeah.
And sometimes they are just sometimes simple advices can make you live for a longer period of time. For example, you have been given that this is insulin. You mean you need to be, because insulin you inject yourself. Okay, you need to inject yourself every day, and then you'll be like, I'm tired. I'm tired of injecting myself, and I feel like I'm healthy now. I'm no longer diabetic, and then you stop injecting yourself. Even if you're on medication, tablets, and then you're like, I'm feeling good now. I'm not even feeling dizzy. I'm not even tired. I'm not like I'm not feeling thirsty frequently. I'm not taking water frequently. I'm not going to the toilet frequently. Then I think I'm diabetic free. And then you stop. By the time you go to the hospital, the diabetes has deteriorated. You can easily die. So what I can advise patients is they should be adherent to the advice and to the medication which they receive. Sometimes you may be diabetic and may not be started on medications. You have just been given an advice. You need to exercise. You need to avoid taking maybe food rich in cholesterol, or you need to reduce the amount of, or you need to stop taking tea. You need to stop taking salty things, all of these things. Just a simple advice like this: increase a lot of vegetables in your diet. Simple advices, and then you are not following that. That's bad, because then you can go into severe diabetic conditions, which is not acceptable. So follow advices which have been given to hospital. And for people who have relatives who are diabetic, and then they are also overweight, they need to go to the hospital and they should be screened for diabetes. Okay? It's not expensive. Sometimes you can go to the private. It's not expensive. I think it's around 1,000 kwacha or 2,000 kwacha. They can screen you for diabetes. It's as simple as just taking some, like the way we do with malaria. We prick you, we take a drop of blood, we check on our machine. Instantly, it gives us the sugar levels. So you can easily control your blood. Let's say you are in a process whereby you can develop diabetes, your sugars are a little bit higher. Then we give you advice. Okay, we give you advice. Okay, your sugars are becoming higher and higher. You can develop diabetes. Please follow this, follow this, follow this. So basically, that's what I can say.
All right. Thanks for your time.
Thank you so much for coming. I think the nation is going to learn something.
Welcome.
Thank you.